I would now like to demonstrate for you a generalized examination sequence of the hip. If the clinician suspects that the patient's source of pain is coming from the lumbar spine as opposed to the hip, a lumbar hip differentiation technique can be utilized. As well, the clinician can utilize a hip scour test in order to rule out the presence of pathology at the hip if a negative test is found. So, let's go ahead and ask Matt to stand on up for me, please. Here we go, and face me. We're going to enter into our functional assessment. Currently, I'm just looking at his overall lower extremity alignment, looking at the hips, looking at the knees, as well as the feet. All right, go ahead and stand on one leg for me, please. Here we are, we're assessing the pelvis, looking for any Trendelenburg sign or hip drop, looking at the subtalar joint, as well as at the knee joint. Go ahead and stand on the other leg for me, please. Very good. Assessing the same thing here. And go ahead and put both feet down and perform a deep squat for me. Here we're assessing general strength, general range of motion, looking for any asymmetries. Very good, thank you. You can go ahead and have a seat for me. Now, after going through the single leg stance as well as the deep squat, a clinician can utilize a gait analysis to look for any lower extremity abnormalities or biomechanical issues that may be causing this patient's pain. I'm not going to perform that right now for the purposes of this video, and I'm going to go ahead and enter directly into the objective examination sequence with respect to active range of motion. I'll be integrating both my active, my passive, as well as my manual muscle testing and passive accessories during this examination sequence as opposed to keeping them separate, so that way the patient avoids having to constantly roll over and flip. So, right now, go ahead, bring this knee and raise it up here for me, please. I'm testing hip flexion strength now. Very good. And let's go ahead and I'm going to stabilize here at the distal femur and bring your leg across for me here. We're looking at external rotation range of motion as well as assessing for strength now. Very good. And go ahead and bring your leg out for me, please. All-right, great. Now internal rotation and strength. For the purposes of this video, I'm just going to be focusing on Matt's right leg. Go ahead and lay on your back for me, please. With your head that direction. Thank you. Now I can assess for hip flexion, active range of motion. Go ahead and put that leg down for me, straighten it out. Bring your knee to your chest, please. All right, we're assessing hip active range of motion. I'm next going to go ahead and apply a force with an overpressure and take him to his full passive physiological end range of motion. There we go. Any pain with that?
Nope.
All right, great. Next I can assess for passive internal rotation. I can switch my hands. I can look for external rotation here. Very good. And go ahead and straighten this leg out. Let me bend this one up and I'm going to cross you over right here. Put your foot flat down. Thank you. And now we're going to assess for adduction at the hip passively. Assessing adduction. Very good. Go ahead and cross your legs for me and slide yourself as far over as you can right there. Thank you. Now I'm going to check for abduction. So I'm going to bring him out. We want to make sure that the hip is in a neutral position. We don't want to have any internal or external compensatory movements. Very good. Now you can go ahead and roll on your left side for me, please. Here we want to assess active range of motion, abduction at the hip. All right. Go ahead, keep this top leg straight. I want you to raise it off for me. Very good. Making sure that we're not having any internal or, pardon me, pelvis rotation here. All right, I'm going to stabilize at the pelvis. Resist me. Very good. All right, excellent. There. Now in this position, we can also perform our passive accessory motions. I'm going to be performing a posterior to anterior mobilization. I'm going to find the greater trochanter. I'm going to stabilize at the ASIS. The table should be raised so that way the clinician is utilizing proper body mechanics. I'm just going to go ahead and drop down right now for the sake of this video, and I'm going to apply a posterior to anterior mobilization, assessing for patient response. Next I'll go ahead and switch my hand placement. I'll go to the anterior portion of the greater trochanter and I'm going to stabilize here posterior on the posterior superior iliac spine, and I'm going to apply an anterior to posterior mobilization. Very good. Now go ahead and roll on your belly for me, please, Matt. Alright, we want to assess for active and passive range of motion for hip extension. So go ahead and keep your right leg straight. I want you to raise it off the table as high as you can. Very good. And relax. Here we go. Stabilize it as PSIS. Perform that again for me, please. Right there, perfect. And resist me. Excellent. I'm going to come around and I'm going to go ahead and perform passive range of motion now. So I'm going to hook him. Here in my axilla, I'm going to grab at his distal femur. I'm going to stabilize it as PSIS. And I'm going to bring him into a hip extension. All right, very good. Now go ahead and roll towards me, please. We're going to assess for a deduction. So go ahead and cross your leg over here. Keeping this lower leg straight, raise it off the table for me, please. Very good. And resist me. All right. Excellent. So go ahead and continue to roll on your back again for me, please. So we've performed active range of motion for all the hip movements. We've performed passive range of motion, as well as we've manual muscle tested and performed all of our passive accessories at this point. Next, what the clinician would like to do is utilize the palpation portion of the examination. So we're going to see if he has any pain over his greater trochanter, any pain around the ASIS, coming down here to the TFL and the iliotibial band, assessing that, going down to Gertie's tubercle and assessing the insertion. Other regions that you may suspect are suffering from the patient's complaint of pain at this point. So after we've completed this examination sequence, what we want to do is we want to go ahead and continue on with our special test in order to help rule in the presence of pathology at the hip. Again, these are going to be highly specific special tests.